All right, it is 12:03. I want to be as respectful as possible of everyone's time today, so let's go ahead and get started. Welcome, everyone. My name is Amanda Graham. I am the Academic Director for the Arthur Irving Institute for Energy and Society at Dartmouth College, and I am thrilled today to welcome our speaker on clean cooking and health, particularly health at early stages of cognition. So we're going to go ahead and get going very shortly. I want to just give a little bit of background on the New Energy series. As I think many of you know, New Energy has been our way of ensuring that early stage researchers in energy, climate, and society are able to have a platform to share their emerging research, and that all of us and the rest of the world have a chance to know who's up and coming in energy and society research. And so we are delighted today to have with us a speaker that we met last summer at our very first summit of the New Energy series. And we are reprising that summit again this summer for any of you early stage energy and society researchers out there who might be interested. We'll have information on how to learn more about that. So I'm really delighted to have Emily with us today, but I don't get to introduce Emily, I get to introduce JT. JT Erba is a lecturer here at Dartmouth College. He is an environmental social scientist, and he focuses on institutional change, international development, and environmental conservation. And so JT, I want to make sure that you have plenty of time, that Emily has plenty of time. So I'm going to hand the mic over to you to introduce Emily, who will then speak for 20-30 minutes or so, and then we'll get back to Q&A. What folks should remember is that any questions that you have go into the Q&A space, and you can send those in any time. It'll be JT's job to sort of wrestle through those, wrangle those questions. We are delighted to have our group with us today, and we really love the fact that in addition to our live audience, we also often have a quite significant asynchronous audience after the video goes up on YouTube. So without further ado, let me hand things over to you, JT, to get us going.
Thanks, Amanda. Hi, everybody. JT Erba here, and I'll be moderating today's talk. And I'm particularly excited about this talk today because I've spent a long time living in rural Indonesia, which I believe some of the talk focuses on. And in rural Indonesia, where I lived for about 4 years, the tangke LPG, which is a kind of omnipresent yellow gas tank, it's about 3 kgs. So it's pretty small. You can fit it on a motorbike. It's just a part of everyday life. You see people driving around with them, carrying them to get filled up. I had to drive my motorbike to get my tangke LPG filled up, often. And so I'm really interested to hear about the energy transition that is built upon that tank that I had so much interaction with over the course of my time teaching and researching in Indonesia. And so without further ado, I will introduce our speaker for today, Dr. Emily Pakhtigian. And Dr. Pakhtigian is an assistant professor of public policy at Penn State, and she is also the Jeffrey L. and Sharon D. Hyde McCourtney Career Development Professor there. She specializes in environmental economics, development economics, and public health, and received her PhD in public policy with a concentration in economics from Duke University. She's published her research in a wide variety of outlets, including World Development, the Journal of Economic Behavior and Organization, Journal of Environmental Economics and Management, Water Resources and Economics, and the Journal of Ecological Economics, among others. And with that, Emily, I will pass the microphone to you.
Excellent. Thank you so much, JT, for that introduction. I don't think we could have found a better moderator than someone who spent years in rural Indonesia and has firsthand experience with some of these pieces that I'm going to talk about today. So thank you for adding that experience. I'm looking forward to the Q&A as well. So I've gone ahead and shared my screen. Hopefully you can all hear me. If there are any technological issues, Amanda or JT, do feel free to jump in. As JT mentioned, my name is Emily Pakhtigian. I'm an assistant professor at the School of Public Policy at Penn State University. And today I'm really excited to be sharing some of my work on early life exposure to clean cooking transitions, and particularly the impacts on cognition and a bit on health with this New Energy series today. This work is joint with Jenny Orgel-Meyer, who is an assistant professor at Franklin and Marshall College, also here in Pennsylvania. And I do have one slight disclaimer before we get started, and that is we're experiencing some winter weather here in State College today, so I'm taking my call from my home instead of my office. So I'm hopeful that my dogs will remain quite quiet in the background, but if you hear some barking, please know that it should end soon. So without further ado, let's get started and talk a little bit about energy transitions. So one of the kind of key pieces that has come out of the development literature in recent years is that access to affordable, reliable, sustainable, and modern energy is seen as the golden thread, or at least one of the golden threads for promoting sustainable development. That is that as households get access to affordable, reliable, sustainable, and modern energy, they can achieve some of the other development goals related to health, gender equity, and the like. And I mentioned those four very specific words: affordable, reliable, sustainable, and modern, as they come directly from the UN Sustainable Development Goal frameworks, particularly SDG 7, which focuses on energy access. And SDG 7 hopes to meet targets related to energy access in a variety of dimensions. So we have indicators that track household electrification, the share of renewables that are part of countries' energy generation portfolios, as well as cooking technologies. And today I'm going to focus on the cooking technologies piece of our efforts towards affordable and clean energy. One of the things that has come out of kind of recent work on examining data related to the indicators and targets for SDG 7 is that without substantial acceleration towards these efforts, we will not globally meet SDG 7 targets by 2030. And so this suggests that we need to kind of think through how to promote policy and acceleration of affordable and clean energy for all. In the cooking dimension in particular, over 2 billion people lack access to clean cooking facilities. Of course, this burden is not distributed evenly across the globe. So we see the largest burden of this lack of clean cooking in sub-Saharan Africa and South and Southeast Asia. And there are a number of reasons that we are concerned about people lacking access to clean cooking facilities. These three dimensions likely don't cover all of them, but we might have concerns from health, environmental, and social perspectives. So on the health side, cooking technology kind of is a large portion of dictating household air pollution, particularly in low and middle income country contexts. And household air pollution is linked to over 2 million premature deaths annually. So there's this kind of clear, immediate health link between cooking technology, access to clean cooking, and human health. There's also an environmental dimension. So the use of biomass and charcoal for cooking release substantial quantities of greenhouse gases like black carbon and carbon dioxide, which contributes to global climate challenges. And relatedly, unsustainable unsustainable harvesting of biomass from forests can lead to unsustainable forest management. So there are environmental components. And then finally, there's a social dimension to this as well. Women and children, it has been shown in academic literature, bear a disproportionate burden of exposure to household air pollution and impact within the household. So not only do we see these global disparities, but we also see some intra-household disparities. So hopefully with this motivation, we recognize a need to expand clean cooking across low and middle income countries. And while, of course, the private sector and households themselves play a role in expanding this access, there has appeared a clear role of national governments in meeting access needs. So national governments have played kind of a variety of transitional roles, helping to facilitate transitions in fuel types away from some of the unimproved, dirtier burning fuels like biomass and charcoal towards cleaner fuels like LPG and electricity. We've also seen national governments involved in technological transitions, so in promoting transitions away from traditional and towards improved cook stoves, which are more efficient and burn fuels more efficiently and generally cleaner. And we also see governments playing a role in market transitions, so making sure that fuel and technology is available and affordable to households. And the kind of context in which I'm going to talk about the role of national governments in meeting these access needs is a story of successful clean cooking transitions in Indonesia. So between 2007 and 2012, there was this large-scale national government-led expansion of access to LPG cooking fuels in Indonesia to about 50 million households. This led to a large reduction in reliance on previous fuels such as biomass and kerosene through LPG distribution channels and also a large subsidization of the fuel. So just to give kind of a visual of what this meant in terms of coverage, these three figures show clean cooking access in terms of the percent of the population in 2006, in 2013 here in the middle, and in 2019 on this side. So here we have kind of the share of clean cooking prior to the rollout of this policy. And we see Indonesia, which is squared here with this black outline, it is experiencing fairly low levels of access comparable to many other parts of South Asia, Southeast Asia, and indeed Sub-Saharan Africa. By 2013, which is towards the end of the policy period, we've seen a substantial jump or darkening in the share. So we see more access to clean cooking, and we see kind of increased access by 2019 as well. And so, just descriptively, looking only at the share, we see something was going on here in the last decade in Indonesia, leading to an increase in the share of population with access to clean cooking. I want to point out that this success story is not borne out in many other parts of Sub-Saharan Africa and Southeast Asia, right, where we still see fairly low levels of access even in 2019, which was the most recent data available. And so what I'm going to share with you today about Indonesia is hopefully providing somewhat of a framework for thinking about how we could have similarly successful transitions in other parts of the world. So to kind of ground this this policy change and the analysis that we're doing related to this policy change in the existing academic literature, I want to highlight very briefly just three threads of the literature. The first is the literature on clean cooking transitions, which have been studied quite extensively, particularly in developing country contexts. And what many of these studies show is that there are indeed environmental and health benefits of clean cooking transitions. Movements such as reduced reliance on biomass, yielding lower carbon emissions and more sustainable forest management. Yet we still see this gap that remains between the private benefits that households receive, maybe they be health, maybe they be social, associated with a clean cooking transition, and the social benefits, so incorporating those environmental benefits of clean cooking transitions. And this is really where we see the necessity of having policy intervention come in and having kind of both that public and private sector investment in such technological transitions. The other thread of the academic literature that I want to acknowledge, because it's going to set up the analysis that I will present today, is that we've seen that environmental health technology investments, particularly in low and middle income country contexts, have a variety of household benefits. And recently we've seen a growing literature demonstrating cognitive impacts, so cognitive benefits related to investments in environmental health. And so this is some of the literature we're hoping to dig into and contribute to. And then finally, as I mentioned, and as I'm going to get to in the next couple of slides, Indonesia is the success story of a clean cooking transition in 2007 to approximately 2012. And there has been analysis of this policy in the past, demonstrating not only successful policy implementation, but also health and labor benefits. And so we're hoping to add to this literature on this policy evaluation to understand additional benefits related to this transition. So with that motivation and background in mind, the remainder of my presentation is going to focus on two research questions. First, we want to examine whether early life exposure to clean cooking, clean cooking technologies and likely reduced indoor air pollution have cognitive and health returns. And for the purposes of time today, I'm going to focus on the cognitive side of things, but do know that we're building out the health side as well. And then we also follow this up by examining heterogeneities in impact, particularly by gender, as there have been demonstrated gender differences in other environmental health interventions. And so we want to examine that in this context as well. Before I dig too far into the analytical strategy and the results that we see related to these research questions, I wanted to start or provide some additional context related to this large-scale conversion program. So I'm going to spend a bit of time here talking about Indonesia's kerosene to LPG mega conversion program. This was the national government's effort to convert households away from the use of kerosene towards the use of LPG for cooking. This was motivated by the fact that the national government was subsidizing kerosene. Kerosene prices were increasing, and so it was seen as a large cost saving to move to subsidization of LPG instead of kerosene. At the time, it was the largest program of its kind globally, reached over 50 million households, which is about 2/3 of Indonesia's population, and had this kind of staggered rollout design in which we saw some early locations in Java and Sumatra that saw early conversion as early as 2007 and 2008, with the remainder of Java and some of the other larger island spaces being converted in 2009. 2010 and 11, and then some of the last areas being converted in 2012 and 13. As you will notice, some of the eastern provinces and many of the eastern islands were not scheduled to be converted, and indeed to this day have not seen the same type of transition. I will note that these islands are less populated. And so, that's about 1/3 of the population, whereas the other islands cover about 2/3 of the Indonesian population. So to learn more about this program and to learn more about this program's kind of success and implementation, my collaborator Jenny and I spent some time in Indonesia on the island of Java this summer, trying to understand different stakeholders' perceptions of this policy change. In doing this and in meeting with these stakeholders, kind of encountered several keys to the program's success. And so the first key that I want to highlight here is the role of implementation partners. So my collaborator and I had meetings with Pertamina, which is the national oil and gas company in Indonesia. And these officials that are pictured here were part of the original kerosene to LPG conversion program, starting with the piloting program that took place in Jakarta in early 2007, and going throughout that rollout that I just described on the previous slide. And Pertamina was the kind of sole distributor of, or sole importer and distributor of LPG, really responsible for this entire conversion program. And this demonstrates the real need to have kind of a strong implementation partner that can have a clear vision of the kind of policy landscape and the implementation and enforcement space. Now, what Pertamina officials also let us know was that while they were, a very clear actor in this program in terms of sourcing the LPG, developing the infrastructure for deposits and cylinder maintenance and having filling stations, Pertamina could not act alone, and they had local implementation partners as well in the form of regional governments and retailers. So once the LPG kind of was distributed from that source of supply, the regional governments then were very strong implementation partners, setting up retailers in locations where people would have access to this new fuel. And so this supply chain was a really essential key to the program's success and the clear coordination between implementation partners. Of course, implementation of the policy from the kind of governmental side is only one piece of the story. A second key to program success was really stakeholder and end user buy-in. And so Jenny and I conducted focus groups in Jakarta and in Jogja, 2 different cities on Java, with households trying to understand how this transition impacted them and their views on this cooking fuel transition. And what we learned from these focus groups were that there were several kind of ways that the government worked to get household buy-in of this program. First was through free distribution of stoves. So households that were transitioning to LPG needed a new stove technology in order to use this fuel. And the first stove kits were distributed freely, which reduced the kind of initial startup costs to households and was key to this program's success. A second piece, and this is something that JT alluded to, was the easy access to cylinders, these cylinders that were available in many local retailer locations. And then finally, there were a series of training and educational campaigns to help households learn how to safely use LPG to ease that transition. So here we have our kind of second key to the program's success in terms of thinking about household buy-in. And the third key that we noticed in terms of program success was really developing a conducive technology. So what we see over here in this picture that I'm circling are the 3 kilogram LPG cylinders that were available at a retail center. Again, these are the cylinders that JT was alluding to. 2 features of these cylinders which are really important are size and mobility. So these are really easy to transport via motorbike, and highly subsidized. And so this type of technology, as opposed to having only larger cylinders, really allowed this transition to flourish. So armed with this kind of background and understanding of this policy, why it was successful, how it was implemented, my collaborator Jenny and I wanted to examine its impacts on children's cognition. And so to do this, we couldn't rely on data that we collected as part of focus groups or stakeholder meetings. Rather, we needed data at the individual and household level that was collected during the policy time period. And so for this, we turned to the Indonesian Family Life Survey, or IFLS, which is an individual and household survey publicly available of over 30,000 households that's representative of about 83% of Indonesia's population. This is a 5-wave panel, and while we use some information from earlier waves, we're going to focus on the most recent wave of data collection, which took place in 2014 and 2015, which is right at the end of the policy implementation period. You might also notice there was a wave in 2007, so we do have some pre-policy implementation information as well. This data set contains comprehensive individual data, and for our purposes, really importantly, there were cognition and math tests administered to individuals above the age of 7 in later waves, which we're going to use as our main outcome of interest. And there are also both self-reported and nurse-administered health measures, which we are further digging into. So how are we going to examine our research question? What are we going to do in order to examine the impacts of this early life exposure to this clean cooking policy on children's cognition? We're going to employ a difference in difference cohort study design in order to identify these impacts. And so I'll talk through this equation very briefly, and then we'll get into kind of results and discussion. So here our main outcome of interest is going to be the cognition score. So the number of questions a child answered correctly on a cognition test for individual I in Regency, which you could think of as like a district or county, R in province T in birth cohort, in province P in both birth cohort T. Our main effect of interest is going to be this beta, which is going to be the effect of being exposed to the policy in early life on a child's cognition score. And how we define this policy variable is we define it as a fraction of the first 5 years of life in which a child experienced the policy exposure. So if policy takes a value of 1/5, that means the child was exposed to the policy starting at age 4. If that policy variable takes a value of 1 or 5/5, that means that child was exposed to the policy starting in their first year of life. We're going to compare children that experience this policy in the first 5 years of life to children who only experience the policy starting in their 6th year of life or later. And the reason that we're focused on this first 5 years is that much of the epidemiological and public health literature suggests that this is a critical time period for kind of forming long-term impacts. We're going to include a variety of individual controls and then some fixed effects, including regency, birth year, and province by birth cohort. We'll cluster our standard errors at the regency level, and again, conduct this analysis first for all children born in the decade preceding the policy rollout, and second, looking at heterogeneity by gender. So this is our main framework, and in the next couple of slides, I'm going to present our main results, as well as a few robustness checks. So our main result here shows our impacts on cognition. So what was the impact of being exposed to this policy during the first 5 years of life on a child's cognition score? So looking first at column 1, which is our analysis of our entire sample, we see a positive impact of policy exposure on children's cognition, meaning that as children are exposed to this policy for more years during that early critical stage of life, we see a positive return to cognition. Thinking about kind of this effect size, we would say that compared to children who were exposed for 0 years in their first 5 years of life, children exposed to this policy during all their first 5 years of life have a 8.3% increase in their cognitive scores. When we look at heterogeneity by gender in columns 2 and 3, we notice that this effect is really driven almost entirely by female children. So we do see, a positive increase for male children, but it's quite imprecise. We see a much larger and much more precisely estimated impact for girls, suggesting about a 14.8% increase in cognition. Now, of course, these are our kind of main results, the main piece that we've seen here, but there are a number of additional questions that might arise. The first thing that might arise, or the first question that might arise, is whether or not people move during this time. So whether kind of there's differential exposure depending on households' locations. And since we have some of that pre-data from earlier waves of IFLS, we are able to examine this same specification, estimate the same specification on a subset of children in households that did not move between 2007 and 2014, or the entire policy implementation period. And when we look at these estimates, we see, slightly less precise estimates, but that the same trends hold, that the impacts are positive and significant for the full sample, and again, driven by female children. We can also, using that pre-data, look at what types of transitions households were experiencing. So what types of fuel were they using in 2007, and what types of fuel were they using in 2014? Because although the policy was quite comprehensive, it is possible that households chose not to transition. And what we see here is kind of very little difference in impact across the different fuel transition types. So most of all of these results, in fact, are quite imprecise. And the ones that kind of mirror our policy, our main results the most clearly, are those related to the kerosene to LPG transition. Perhaps not surprising, as this is the main transition targeted by the policy. Yet, I do not want to put too much stock in these, given the imprecise estimations. And then finally, we are also able to look at impacts on those math scores, as I mentioned, and here we do not see any impacts of this policy on math scores. And while this might be surprising to some, this is a very consistent finding in the literature, that we see kind of movement on the cognitive, logical, verbal side of test scores, but do not see movement as a result of environmental health interventions on the math score side. And so this is consistent with the existing literature. So I'll conclude here with my last couple of slides on kind of our next steps and discussion here. We do have some analytical plans for looking at additional outcomes, such as measured health outcomes and stated. as well as refining our differences in difference approach. As some of you may be aware, there's been kind of a large methodological debate in the difference in differences literature, particularly related to estimation around staggered policy rollouts. And so we are currently working on refining our cohort study to adjust to these changes. And we are also, working on specification robustness, thinking about alternative exposure time periods. So finally, just to conclude here, thinking about the contributions of this early stage work and kind of how we can think about this more broadly within the policy landscape, there is indeed a growing literature on the cognitive impacts of environmental health technology adoption and use. And the gendered impacts within this literature suggest that these interventions are often cognitively more advantageous for girls. We find this to be the case with a really large-scale clean cooking transition that took place in Indonesia. And we find that girls who are exposed to clean energy policies early in life have this cognitive advantage. And there are a number of reasons that we might expect to see this pattern. So it could be explained by time use patterns, that girls are more likely to be involved with cooking activities or wood collecting activities which change as a result of this policy. But it also could be a result of other early life investments in children, which in some cases are disproportionately provided to boys rather than girls, suggesting that there are larger gains to be made from other interventions on girl children. Finally, I do want to kind of tie this back to the broader policy landscape. This LPG conversion program is a success story in policy design and implementation. Indonesia has many reasons to be very proud of this policy and has in fact used this as a framework for thinking about subsequent policy design. What we show here is that it's important to estimate not only the direct benefits of such a policy, so how many households are transitioning, what are the immediate effects, but also some of the kind of broader scale indirect benefits, such as those impacts on cognition, which could have really long-term positive effects of such a policy. We note that this is a kind of informative story for thinking about not only designing and implementing, but also evaluating future cooking transitions in Indonesia and around the world. And this is indeed, going on as we speak. So Indonesia is currently examining options for transitioning away from LPG fuels and towards electricity for cooking. And government officials from Indonesia and from Pertamina, the national gas company, have shared their stories of program implementation and design and success with other national governments who are interested in implementing similar policies in their own countries. And so there's really a lot to be learned from such a transition, which really can help to make up some of the ground that we will need to meet Sustainable Development Goal 7 related to energy and clean cooking transitions. So thank you all very much for your attention and for being here today. Looking forward to the Q&A and discussion to come.
All right, thank you so much, Emily, for that talk. This is fantastic. I've been wanting to learn more about the LPG rollout for some time, and it's like checked all the boxes for me, so it's fantastic. For those of you in attendance, if you want to submit questions on the Q&A, it's open and please do so. In the meantime, I've got a question here from Amanda. Will the research team try to connect with African nations to help them see or realize the benefits of this kind of policy? And I'll bundle that with one question I have, because I have a million. So Pertamina is a state-owned oil and gas company. Mm-hmm. And I'm wondering to what extent that affected the rollout of this policy, how that changed this incredible transition that you saw, and whether or not those lessons, given the state ownership of this company, are applicable to other contexts.
Yeah, so these are both really important questions. So I'm going to tackle the question related to Pertamina first. in that it is a really important key that this is a state-owned company, right? And so because they could work so closely with the national government, this was kind of a really key piece in being able to source enough LPG and distribute enough LPG to kind of smooth out the transition. Now, that being said, especially in retrospective analysis, and now it's been several years, and so the company is, I think, a little more open to kind of discussing the things that went really smoothly and things that went less smoothly with the transition. One of the things that has become quite clear is that there are hiccups along the way, even with a state-owned company, right? And so yes, by now access is quite good, and there are kind of few distribution lags. There of course were some stumbles along the way. One thing that also makes Indonesia somewhat unique in this fuel sourcing is that the country itself did not have any kind of access to kerosene or LPG. So either of these fuels, everything was imported. And so this was a really another, I think, key as to why having a state company involved was really important. And that would be because, there was this kind of like import-export international trade component that private companies, especially at a smaller scale, might have more challenges setting up. And so depending on, a different country's setup in terms of what types of fuel they need to import, what types of fuels they actually have, there might be, a stronger or less strong claim for really needing kind of a state-run effort. And that transitions us nicely to Amanda's question, thinking about what might there, where there might be differences or similarities for other countries. So you perhaps recall that figure, which really demonstrates that a lot of these remaining clean cooking challenges are in sub-Saharan Africa. There's certainly some challenges in South and Southeast Asia as well, but the kind of share of the population with clean cooking in several parts of sub-Saharan Africa remain the most limited. And indeed, sub-Saharan Africa is one of the regions that officials from Pertamina have traveled to and worked with governments to kind of talk about such transitions. We are kind of currently thinking about these transitions in Indonesia, but do have some ongoing work and some pending grant applications and such to expand this work more broadly. And sub-Saharan Africa would be kind of the next region of target. It's a little bit more challenging for two reasons. One, slightly less publicly available data. So IFLS is this great source to be able to retrospectively look at some of these pieces. And the second is that a lot of these transitions are ongoing. So doing kind of like ongoing analysis of a current policy or even ex-ante policy analysis of a policy that's being kind of considered or thought about, just requires a slightly different tool set. So there's kind of a number of different things to consider there, but certainly an important region.
Great, thanks for those answers. We had a question come in and it asks, does household level play a role in the model?
Yeah.
Household income level.
Great, thank you.
Does household income level play a role in the model?
Yeah, so there's kind of an analytical question to this answer to this question, and then a conceptual answer to this question. So the analytical piece is that we have played with a different kind of set of controls, using just individual level controls, using household controls as well. Our results are pretty robust, including things like an asset index or some sort of measure of wealth. And so we're not necessarily concerned that household wealth is kind of driving the transition that we see. We also do note that we see kind of very little in terms of impact for households that started out using LPG. Those would have been the richer households in 2007, and that are still using LPG in 2014 or 2015 when they're re-interviewed. And so that suggests that what's being driven or what's driving these impacts are transitions from things like kerosene or biomass, and not just schools improving or something like that, being able to kind of improve over that time. Conceptually, I also do want to mention that one of the things that Indonesia has kind of struggled with from a policy perspective is figuring out the appropriate level of subsidization. So these 3 kg canisters of LPG, those are the canisters that are subsidized. So the household isn't receiving a subsidy based on their income or based on their, explicitly based on their use. Rather, they're able to purchase a subsidized product. And so really, there in practice or in theory could be some restrictions on who can buy these smaller canisters, right, to try to better target those subsidies to households that are more in need. But in practice, most households, regardless of their income levels, and indeed some small businesses and such, purchase these subsidized canisters. And so a lot of the subsidies, of course, do go to low-income households, but many of the cooking fuels are subsidized for higher income households as well. So from the policy perspective, we kind of see that this subsidization is not necessarily targeted explicitly based on need. And that is one of the pieces that Indonesia is kind of grappling with as they think about future energy transitions as well. So as they're thinking about trying to transition people away from LPG and towards something that could be domestically generated like electricity, the subsidization piece plays a really large role, right? Because if you start subsidizing electricity, questions arise as to how much to subsidize. Can you just subsidize electricity for cooking versus electricity for other uses? And so things, kind of increase in complication related to policy implementation. So there are a number of kind of different factors at play here when we're thinking about who is actually impacted by the policy and how that policy is targeted.
Great, thanks. That's so interesting. I didn't realize that about the subsidization process. I was also wondering, based on the analytic strategy, it seems like looking at policy years within a child's life, you're treating them all equal. And public health is not my forte, but I was wondering, is that borne out by the public health literature, that there is no bunchiness in exposure years or anything like that in terms of the risk that it poses to children?
Yeah, so another great question, and something that we're trying to kind of dig or build some robustness around in terms of how we're actually defining that exposure. So there are a couple of different kind of key windows in the public health literature that seem like they would be important time frame windows. So one is the time frame in utero. What are you exposed to in utero, which is actually not really accounted for in our model at all, because we're looking at birth cohort years. We have very limited, we could kind of make some guesses about kind of time spent in utero exposures, but that piece, that's kind of like one critical period that I would say is missing from our analysis. Second, it seems pretty clear that early life exposures are more problematic than exposures later in life. Now, how you define early life differs, depending on things like, what the medical literature tells us, what data you actually have, and how kind of carefully you can measure these pieces. Often people kind of think about early life as either the window from 0 to 2 or the window from 0 to 5. A lot of the kind of WHO initiatives around environmental health, so around kind of clean water and those types of pieces, measure most of these diseases for under 5, and so that's kind of the period that we've looked at, but there are kind of a couple of different ways to think about it. The last thing I'll mention is that we are comparing, kids that were exposed from 0 to 5 to kids that were exposed from, age 6 or older, right? Because at some point, everyone is exposed to the policy. And so we're finding some evidence that the timing does matter. We haven't necessarily refined it as carefully to, is it just in year 1 and 2, or is it in subsequent years? We've done a bit of additional analysis looking at just the youngest children, and we see pretty similar effects. But in that case, we're comparing pretty young children to much older children, right? Like the ages are different. And so there's some questions about really just the kind of specific role of age then in how children are performing on these cognitive scores, even though we try to control for that. And so we think the combination of that evidence kind of provides the stronger picture there.
Great, and that makes a lot of sense. And while I'm tempted to ask you about what's your potential favorite staggered diff and diff model format, I think we're going to move away from the analysis questions right now. We've got two that just came in. And Anson Gok asks, does this transition have impacts on local supply chain or local suppliers of the original energy source? And are there any benefits or costs analysis? And additionally, thinking about recycling costs?
Awesome. So this is a great question. And this is actually something that came up when we were in Indonesia. We met with some local retailers of the LPG canisters. And many of them had been distributors of kerosene prior to distributing LPG. And so we saw this kind of like, you know, the distributors themselves were not overly concerned about this transition. In fact, you know, if anything, it was kind of beneficial to them. People could sell LPG, I think, more easily. The canisters were kind of more conducive to use. People were buying it, so there was a market. And so that transition was fairly straightforward. Now, there's increasing concern among distributors about future transitions, because it would likely be a transition away from kind of like a solid or liquid fuel source towards something like electricity, where there wouldn't be a retailer distributor. It would be more so, you know, a grid connection or something along those lines. And so for future energy transitions, this is a really important component, right? Thinking about the supply side and thinking about what this would mean for small retailers, and kind of folding retailers into the policy change to ensure that there aren't these really large kind of costs to local economies. But in terms of the kerosene to LPG, it seems, at least from the retailers we spoke to, that it was a pretty smooth transition, and that many of those retailers simply switched their fuel source and fuel type. Given that all of this fuel is imported, both the kerosene and the LPG, and imported generally by a state-owned company, they could even just access this, you know, a different fuel, but from the same kind of distribution center that they were accustomed to working with. So I think that transition was pretty smooth, but I think this would be a really large question for future transitions.
Really interesting. I was wondering, it looks like you have just incredible data from the IFLS. And I was wondering, are you able to evaluate household energy portfolios? So thinking about LPG as just one element that households are using, and thinking about kind of a broader energy portfolio, maybe limited to cooking, maybe expanded kind of more generally.
Yeah, so this is, you know, everyone's had such great questions. So thanks for such a robust discussion. You know, there are kind of a number of different ways that IFLS tries to understand households' energy use. So they ask not only about the primary cooking fuels, which is the main piece that we've played into here, but they also ask about things like expenditures on different types of fuels, and kind of not like explicitly use, but engagement with different types of fuels. And this is actually a really important question, and something that I don't think our analysis kind of has looked into too carefully. But in the cook stove literature, and the cooking fuel literature, what no one would be surprised to hear, that you know is kind of involved in that literature, is that there is just it's really challenging to collect all of the data about cooking fuels that households use, because the evidence that households are stacking fuels and stacking stove types is just overwhelming, right? Like that's what households are doing. Yes, they might primarily be using LPG, but that doesn't mean that they're not also using firewood or using charcoal. And so I actually think the idea posed here that perhaps we could examine, you know, expenditures on different fuels as another way of thinking about kind of a fuller energy portfolio, at least in the cooking space, might to kind of help refine what some of those transition categories look like. As I mentioned, we don't see a lot of kind of precise estimates there. We cut the sample quite a bit and kind of splice it in different ways. And so that might be, you know, another really useful thing to dig into.
Great. And we have one more question here from Leo Jane. What is the challenge of the potential transition from LPG to clean electricity cooking in the countries you have been studying?
Yeah, so there's kind of, I think, two main pieces that I want to highlight here. So the first is that Indonesia has kind of seen a series of cooking transition or cooking fuel transitions. So, just like many other places in the world, people start using firewood and charcoal, right? Like that's the earliest cooking fuel. At some point, then Indonesia's government kind of ramped up imports of and subsidization for kerosene. So kind of transitioning households away from biomass to some extent towards kerosene. Then, of course, this policy that we've been discussing here is a transition to LPG. In terms of kind of moving forward from LPG to electricity, one of the things that, at least in Indonesia, people have become quite accustomed to is this subsidization of cooking fuel. So we talked to households in the focus groups not only about the past transition, but also asked them, what would your interest in transitioning to electric induction look like? Or, would this be a transition you'd be willing to engage with? And the general answer, of course, it's not what everyone said, but the general answer was, I'm willing to transition to a new fuel as long as it's subsidized, right? So it's not so much the exact type of fuel, but more so what the actual expenditure would be for these households. And so for electricity, this presents a bigger challenge because there are many more uses for electricity than there are for some of these other fuels like kerosene and LPG. Yes, you could be using them for lighting or some other things other than just cooking, but the main purpose is for cooking, whereas electricity, you can imagine, has many other uses. And so the government, has been thinking about how they could continue the sense of subsidization of cooking fuels while not subsidizing all energy or all electricity use. And so that's a really big challenge. The second challenge, in particular for Indonesia, is the source of the electricity. So of course, we can source electricity from renewables, but we can also source electricity from fossil fuels. And Indonesia happens to have quite a bit of coal. And while many of Indonesia's policies are really forward-looking in terms of climate, it's an island nation. It's experienced a lot of impacts of climate change already. There could be kind of these stopgap measures of thinking about transitions that actually lead to kind of more pollution via coal or more extraction of coal. And so that's another piece. I like the part of this question that says, clean electricity cooking, because I think that's actually a question as to where this electricity would come from and how we could make sure that kind of fit the SDG 7, sustainable energy piece of the transition.
Excellent. And so that takes us to 12:56. And Emily, I was wondering if you had any kind of final thoughts you might like to leave us with here.
I will just mention that, well, first, I do want to thank the Irving Institute for including me in this seminar and thank JT for great moderation of these questions. I would just note that, as we think about sustainable development and access to energy, cooking is a big part of this. It's an important piece for the environmental, health, and social reasons that I mentioned. Other energy access issues like electrification or high quality electricity remain really pressing challenges in many low and middle income countries. And so thinking about how we can make progress towards these goals, even if, perhaps we're not going to reach the targets of 100% by 2030, but how to kind of design policy to reach these goals, I think is going to be a really important piece of the kind of global policy landscape. And I'm hopeful that these conversations continue in forums just like this.
Thank you so much, Emily.
Emily, thank you for a fascinating and really useful talk to expose all of us to issues that don't often get brought to the top, right? In terms of the, especially the pediatric cognitive impacts, right, of the fuels and the technologies that we're using. So, and really exciting to see the possible, pathways forward, right? Whether it's, further study in Indonesia or further study or policy intervention in sub-Saharan Africa. So, so thank you for a wide-ranging but also really focused and empirically grounded introduction to this space. JT, thank you so much for being our moderator for today, and to all, thank you for great questions and great conversation. I'm going to transition us now to thinking about what comes next. So we have our new energy series 4 times per season for most seasons of the year, hosted by the Irving Institute. And the next one is coming up 2 weeks from today. We have doctoral student Vivek Shastri from UT Austin speaking on productive uses of decentralized renewable energy, and he will be focusing on that in the context of India. And so tune in for that, register for that, and then we'll have a little bit of a break before we come back in April for our next series, our spring series. Also, if you are a young energy and climate researcher, an advanced PhD student, a postdoc, an assistant prof, or you know somebody who is, please point them to us, because we're openly taking applications for our New Energy Summer Summit. This is 2.0 for our Summer Summit that Emily attended last summer. And the whole idea here is to do more than to add to the knowledge that we are sharing with the world through our webinars, but to actually bring that community of young people together, to have multi and cross-disciplinary engagement and networking, what it's like to be a researcher in this space, right? Just starting out. So we'd love to hear from you if you're interested in participating in the Summer Summit or know somebody who is. With that, I will close us out for the week. Thank you all so much for being here, especially our speaker, Emily, and our moderator, JT. And I wish everyone a safe and well rest of your day. Thank you.